expose a little bit of the base of the spine. Is it okay?
Yeah, that's cool.
So let's roll it down here a little bit. Okay. Okay. See, it was because of that. Okay. So we are going to be palpating, the spine. What do I have there first? Okay, spinal processes. So let's start with spinal processes of from the cervical spine all the way down and see how many we can find. So the first thing that I'm going to try to do here is to try to find the external occipital protuberance, which is really easy if we just palpate it here in the middle. Everybody can see in the camera, right? Okay, so if I slide my fingers down, probably like an inch and a half, the first bony prominence that I'm going to feel is going to be C2, right? C2, and because he is in extension, a lot of spinous processes are going to be found between here and here, which is the base of the cervical spine, and this would be C7. So essentially C2.
Can we turn off the light so we can see it better?
C3, I don't know if that's going to work. Okay. C4, C5, C6, and C7. So they're very close together. So let's, okay, this would be C7. I thought it would be more bright this color, but it is not. Okay.
Pink or black?
Black maybe. Okay, thank you. So C7, right? Then what's below? T1, right? T1. And the next one would be T2, right? And T2, which we need to find, is at the same level of the superior angle of the scapula. So if you find both superior angle of the scapula here, just across, that should be your C2. Sorry, T2. Then T3, T4, gap, T5, gap, T6, gap, T7. And normally T7 that you also need to find is kind of at the same angle or the same level of the inferior angle of the scapula. So if you draw a line between the inferior angle of the scapula across, that should be T7, approximately. Everybody's made up differently, okay? Gap, T8. See, when there is more tissue, you have to go deeper, okay? And there's a gap here. Would be T8, T9, gap, and T10, gap, and T11, gap, and here T12 approximately. So the 12 ribs kind of attaches there. So if you have to follow also the 12 ribs in that arch, it should probably take you up to T12. Okay, let's see where we are now. Because another thing that you need to find is going to be the iliac crest. So normally when you're assessing a patient, you can do this in sitting or standing, most likely in standing. But right now also, because we're trying to use the camera and the angle, I'm gonna show it in prone. And also the advantage is that when he's laying prone, there's a lot of soft tissue here. So it's just easier to get your hands around here and find the iliac crest. And I'm on top of the iliac crest. So you have to go deep and try to find the iliac crest on both sides. So I'm just going to draw here where kind of the iliac crest is. And it kind of goes around here. The top of the iliac crest normally also can be at the same level of L4, which I have it over there. You need to find L4. It's not the best way to find that level, but it's a good way to find L4. Okay, so I would assume that kind of here, this bony prominence that I feel is L4 right there. Now, if you follow those iliac crests with your thumb here, you're gonna reach this point where you have these dimples, and this is very bony here, and you have two bony prominences here. Well, these are called the PSISs. Easier to find almost in everybody. Some people, you see those dimples, and you just basically go there and you say, that's where they are, the PSISs. So here they are. PSISs, okay? Across PSIS, if you draw a line, that's where the second sacral vertebra should be located, which you have to find. Also, you have S2 right there, okay? So, according to some people, the best way to find the lumbar segments is gonna be finding the PSISs, find S2 in the middle, and move up where you have S1, okay? And then you're gonna have L5, L4, which is almost at the same level, L3, L2, and L1. And probably I was off over here by one segment. It helps when you have the person for the thoracic spine sitting down, because you can ask them to flex forward, and when they do, the gap makes it more obvious to find those levels, okay? So what we have found so far, spinous processes, iliac crest, PSIS, the sacrum, which we found already, that S2, and if you put your fingers across S2, let me find PSIS here, in the middle, and you roll your finger across the sacrum. I'm in the sacrum right now. That should be your medial crest, because the medial crest of the sacrum is formed by all the spinous processes. Remember that these segments are fused together, right? It forms just one single bone. Let me move up here and try to find these mastoid processes. And the mastoid process is the best way to find. You find the external occipital protuberance here. And as you move laterally in a straight line, that should be the superior nuchal line. And as you keep moving up and down here, you get to these bony prominences behind the ear, and that's the mastoid processes. Okay, so that would be the mastoid processes. Okay, ligamentum nuchae is in the middle here of all the spinous processes of the cervical spine. So if you're palpating that, you're palpating that ligamentum nuchae. Can I ask you to do this chin tuck here? And when he does this chin tuck, you can feel that that ligament is now being stretched out. And in some people, it will stick out. And in some people, that doesn't stick out. Just roll your finger side to side, and you're gonna feel that ligament. Okay? And the last thing that I wanna palpate is going to be the transverse processes, which here in the cervical spine, they're like a little bit more difficult to identify by one, but at some point you're gonna be able to feel like a ridge of all the bony prominences. But in the thoracic spine, if you find the spinous processes, relax, okay, there we go. And you move about 1.5 inches to the side, and try to get those muscles out of the way, you're gonna feel the costotransverse joint, essentially, where you go to the rib and the transverse process on this side. So you should be able to feel how that thumb jump on top of those bony prominences over here. And I'm putting two of my thumbs over here because in between those two thumbs, what you see is the lamina groove, which is formed by the spinous processes and the transverse processes. And all the multifidi muscles, they live there, and we're gonna be palpating those later. Any questions? I think everything from the board was addressed, okay? Okay, thank you. Okay.